and so one of you should be able to share your screen.
Okay, well, I'm going to start. I don't have a screen to put up for sharing purposes, so you're just going to have to look at my lovely face and hear my words. So Ron and I have already communicated, and I'm going to do the lead off here. And then Ron is, we're back and forth. We're going to flip back and forth on how the rest of the afternoon goes. So first of all, I would like to say good afternoon to everyone. I'm delighted to be co-chairing this Atlantic meeting today with my colleague, Ron Swan, who is the president of Carp, Nova Scotia. I'm Sharon Callahan, and I am the president of Carp, Newfoundland and Labrador. I trust that those of you who participated in the national meeting found the meeting discussion to be interesting, concerning, and also enlightening in the fact that the subjects under discussion were sensitive ones, but ones that we all need to get behind and not let rest until an acceptable and respectful continuum of care is established. While the COVID pandemic has exposed quite dramatically what many of us have been saying about our healthcare system, especially the institutional care system for our elderly and other vulnerable persons, for quite some time, it is not acceptable, though, now to only have this exposure and then to sit back and trust that the governments will take the right action. We are the citizens of this country, and we are the consumers of these services. If not now, then maybe into our futures. And the time for us is now to be the drivers of the care that we want and expect for our loved ones and for ourselves. So before we begin, I would ask Ron to make some opening remarks, and then Ron is going to introduce Bill to make some further remarks. Ron?
Thank you very much. On behalf of Carp, Nova Scotia, I am very pleased to be part of this national conversation and to extend it here into Atlantic Canada to discuss the continuum of care, where we are in providing that capability to our citizens today and where we should be, and to initiate the action that needs to happen. It's taken far too long to get to this point, and that's what today is very much about, is really starting to put some legs under this so that we can bring about the changes that we all know are necessary. On behalf of Carp's almost 10,000 members in Nova Scotia, we want to move forward and basically make Nova Scotia and Canada a better place for older Canadians. So that being said, I'd like to pass over to Bill for some remarks, please, on the national meeting that Bill just led, and we'll continue our regional conversation.
Well, thank you very much, Ron. And I want to begin by thanking you and Sharon for all your work in putting this together, and to Sean Fitch, who's on our staff in Toronto, one of the keys to making sure everything works well, and he's making sure that technically we're doing well today. I should mention to some of the newer people who are on the program today, perhaps using Zoom, I'm seeing some questions in the chat. Somewhere on your screen, and if you're using a PC, probably the upper right-hand corner, there's a place where you can change your screen view. So if you're only seeing one of us at the moment, you want to see all 6 of us, or if you want to change what the view is, click on that, what's called speaker view, and you'll be able to change what you're able to see. I'm not going to take a lot of time this afternoon now to talk about the national program. I had plenty of time on the national show to talk about that. I'm really more interested in sitting along with all the other participants to listen to your input and what we need to do to really change long-term care in Atlantic Canada. So I'm going to turn it back to you and hope that we have and know we'll have a very good discussion this afternoon.
Okay, thank you, Bill. Our goal for today then is to continue the discussion that was begun during the past hour, but to enhance that discussion, as Bill and Ron have both said, from our Atlantic perspective. We have 3 excellent presenters for you this afternoon in the persons of Dr. Suzanne Brake, the Seniors Advocate for Newfoundland and Labrador, Ann Gillies, a founding member of the Coalition for Nova Scotians for Long-Term Care Reform, and for Ann Camozzi, a Canadian artist and writer, a disability and seniors advocate, and a caregiver, also from Nova Scotia. So welcome, panelists. And to kick off this afternoon, we're going to go in the order of the names that I just spoke. So it is my pleasure now to introduce to you Dr. Suzanne Brake, the Seniors Advocate of Newfoundland and Labrador. And I know some of you have heard Dr. Brake speak before, but the message that she brings is always one that is important to hear again and again, because it reinforces in our mind and in our actions how important it is for all of us to take action and to carry that message forward. And we can't leave it to a single voice to only speak up for what we feel is right in terms of the continuum of care. So Dr. Brake has a lengthy history of involvement in the area of aging and seniors, which includes a long list of clinical, managerial, administrative, teaching, research, and policy experience. Following her appointment as the inaugural Seniors Advocate for our province, our inaugural and our only one, Dr. Brake spent the first year consulting, collaborating, and collecting information on the systemic issues that are of critical importance for seniors in Newfoundland and Labrador. And you'll hear that these issues are not ones that are only common to Newfoundland and Labrador. I think you'll find they are very similar in all provincial jurisdictions, but of course this is particular for us in Atlantic Canada. So on September 25th, a year ago, Dr. Brake released her first report, and since COVID-19, she's spoken publicly about the issues that have impacted seniors during this crisis period, and she's challenged government leaders and officials to implement changes that will better the lives of all seniors, especially the most vulnerable. So I'm pleased to present to you Dr. Suzanne Brake. Suzanne.
Thank you so much. Can you hear me okay now?
Yes, we can. Yep.
Okay.
Do you need to share your screen? Are you using a PowerPoint?
No.
Okay, all right.
No, I don't have a PowerPoint. First of all, I'd like to say thank you to everyone for the last hour in terms of the national call. It was so interesting, and it made me feel like I'm not just a lone voice. It made me feel like people all across our country, throughout our whole country, are recognizing and seeing some of the same issues and concerns that we have been talking about. And as a seniors advocate, I've only been in this position 3 years, but before that, like many years before that, we've been having the same conversation, and it feels like over and over again. Now, for your listeners out there, all 86 of them, it looks like, we've been told, us presenters, that we only have 5 to 7 minutes to speak. So I better get right to it. That's the way I look at this. So my office was created in November of 2017, as Sharon just indicated. And it was the first seniors advocate office in the province of Newfoundland. So I became the inaugural seniors advocate. It is a statutory office. It reports directly to the House of Assembly, and it was created through the Seniors Advocate Act. The role of the office specifically, and this is embedded into our act, is to identify, to review, and to analyze systemic issues relating to seniors. And when we say systemic, obviously we mean those bigger, broad issues which impact seniors, like the whole long-term care system. Secondly, to work collaboratively with seniors organizations like Carp, like Seniors NL, like the 50 Plus Federation, all those other kinds of organizations, and service providers and others to identify and to address those seniors issues related to seniors, and to make recommendations to government and government agencies and others respecting changes to improve senior services. It's been a tough year, we all know that. The focus on our office is on systemic issues, and those are those broad issues found in society rather than those individual or isolated issues. So that's an important piece to remember about our office. And our legislation identifies systemic issues falling within 5 broad areas, and you'll know what they are. Their health care, their personal care, their housing, their transportation, there's finances, not only the issues that we have seen through other reports and literature and et cetera, but those are the issues we live with ourselves. And of course, we all know that these are interconnected. All of these are interconnected. They're sometimes it feels like impossibly, but they're incredibly complex. And responses can't be addressed by any one person. I always say in any presentation I do in Newfoundland and Labrador that I am not the only seniors advocate. Every single person who's come forward to listen and to hear and to participate, they too are advocates. They are seniors advocates. So as Sharon mentioned, it was last September, a year ago, and I have no idea what happened to this year. It's all a bit of a blur for me this whole year. But we've kept on moving forward, and we identified in our report, based on significant consultations throughout the province, and not only that, I've been in this seniors and aging world, and now I feel, well, I am one. I am a 63-year-old woman living in this room, this world, and I'm aging too. So the broad priority areas that were identified were called aging in place, and I heard that in the last presentations. Healthcare, obviously, which within that falls the long-term care. And the third one is called labor force participation. And that was a little bit of a surprise to me, because not necessarily the issue, but the numbers of people who were coming forward and talking about the importance of continuing to work because people want to continue to work, or others who need to continue to work, and the obstacles that people were being faced with. Now, there's not enough time for me to speak about all the issues that were identified in our report, so I'd just like to kind of focus on a few which are highlighted. First, unquestionably, one of the biggest issues and concerns that was presented to us, really was about the care of seniors within hospitals, including mental health facilities, within what we call personal care homes, within long-term care facilities, and those things were utmost and the tops of people's minds. And it should not surprise you that, again, these are very complex issues and they're very interrelated. The lens of COVID raised that awareness up incredibly. And we saw that throughout our country. Newfoundland and Labrador, we've been very fortunate in that we had one case identified in a long-term care facility, and that was even questionable, whether that was really a case or a negative risk, or what they call false positives, false negatives, etc. And we've had no deaths in long-term care. We've had 3 deaths in the province. Some people, it says because we're surrounded by water, but there you go. Regardless, part of us is surrounded by water, not all of us. I really do have to mention one of the most troubling things that was brought to my attention over and over again, and that's what I called repeated reports from people who are living in long-term care facilities, or their families, or their significant others and important people in their lives, about what they called, or what I came to call, fear of reprisal if they reported their concerns. So it was really concerning to me that too many families felt that they were unable to speak about the issues that they identified with staff and management because they were fearful of being labeled a troubled family or troubled residents. And that they thought that that could lead to more issues or concerns. So to me, it was important to out that issue. It was important for us all to think about what does that really mean? Because there wasn't, don't get me wrong, this wasn't an exaggeration. People felt this, they really did. And it was important for me to speak to that issue, and I have continued to speak to that issue. And I think that, I'm not sure if it was Bill or someone in the last presentation talked about the issue of ageism, and I certainly think that's part of this, that there certainly is, you know, a big piece of lack of real, true integration of people as we grow older in our society. The big thing was that while many residents and many families, they recognize that staff and managers, and many of those people are very kind and very caring, there were others who felt they were not. And that's just not acceptable. It's just not acceptable in the world that we live in. British Columbia did a survey a few years ago, and they actually asked questions to families and friends and residents and people living in long-term care, and they were able to come up with some very concrete recommendations, etc., which some of it was actually used when they were using their response to COVID this past year. So in Newfoundland and Labrador, I am working with a team of researchers to replicate that study. To me, that's an important step to take because I just feel that there are still too many voices that are being silenced, and we need to hear exactly what they think and help engage them into that kind of a difficult conversation. During the early days of COVID, visitation of family and friends was totally eliminated unless a person was dying. And in fact, some of that is still happening in Newfoundland and Labrador. You know, there are people who fly into Newfoundland to be with their mom or dad or, you know, their loved one at the end of their life, and they're still not getting to see them. So we really have to work harder on that, especially given the fact that we're saying we have another course of this disease that's emerging its ugly head. So we really do have to think about that as well. Bill, you did a great job of explaining all of the issues around long-term care in your presentation. So I'm just going to say, you know, ditto to that, but what I have identified is that we really do have to keep on recommending to government to embark on a complete review of our system with a review and implementation process in place. So that includes home support services, mental health services, acute care, personal care, long-term care homes. We need to figure out the whole issue about the right staffing, the right skill mix, the right numbers of hours of care. We need to figure out why is it that still couples who want to stay together, not everybody wants to, but who want together to stay together, why are they still being separated? All because of availability, et cetera, et cetera. So we really do have to figure out that. And we have to figure out how we can best reduce institutional spaces. And I don't care what anybody says, to me, they're still institutional spaces. And we need to really start looking at more appropriate, more age-friendly, more accommodating, you know, community-based services and programs and housing. You know, we really figured out how disjointed our system really was when this all happened, because there were many, many people who stepped up to the plate and helped, but still, it took a long time. It took a long time for us all to get our act together and figure out who needed food, who needed medication, who needed this, who needed that. And I was like sitting back thinking to myself, what is going on here? We really do have to do a better approach to that. So that's another recommendation I was making. We got to be better prepared. The third issue I have to talk about, because if I don't, I can't live with myself. And that's the whole issue of dental, hearing, and vision care. I know we're talking about long-term care facilities primarily here, but seriously, you know, we have a country where we primarily have decided that hearing, vision, and oral health is divorced from the rest of our bodies. So our Canada Health Act does not include those. And so we got to figure that out too. That's just not acceptable either. And we keep saying it, everybody keeps saying it. Well, it's time for that saying to be translated into doing. Well,
Suzanne, you
I know.
have to wrap up.
I'm wrapping up now. The Canada
Okay.
Health Act needs to include those things. Lastly, of course, medications is of importance, and we all know that. So, no doubt that in order to have lasting, meaningful, changes, we all have to work together. And I know that the next two speakers are going to focus, the Anne and the Anne, they're going to focus specifically on long-term care reform and also long-term care in terms of the whole big picture and from the perspective of Anne, who is living that. So I'm really looking forward to hearing that as well. So I hope what I've had to share, is meaningful, because I think it certainly, translates to every province and territory. Thank you.
Thank you, Suzanne. Thank you so very much. And it's a great introduction to the two Anns on their perspectives that they are going to bring. So Ron, over to you.
Thank you very much. As always, Suzanne, you're wonderful to listen to. Really enjoy listening. Thank you so much. That being said, 2 to 3 years ago, Carp, Nova Scotia set about to put in place a health advocacy committee. And under the leadership of Paula Wedge, who is our vice chair, she put a lot of work into that and developed the committee and got it off the ground and started some very good work. Paula has recently stepped back from that, and it's now under the leadership of Lawson, who has excellent credentials through Dalhousie Family Medicine for the last 20 plus years. But that committee wouldn't exist without Paula's work. And I thank Paula for doing that. And I have every confidence that, that Bev is going to do an excellent job as we go forward. The reason I asked both Ann Gillies and Ann Camozzi to join us here today is they both have a tremendous amount of experience in the subject matter that we're discussing, which is long-term care, continuing care, and they both bring different perspectives to the table. I'll start out with Ann Gillies and then introduce you to Ann Camozzi before we get into our questions and answers. Ann Gillies lives in Halifax, Nova Scotia. She was born near Montreal, Quebec, and has lived in the Ottawa region, Toronto, rural Nova Scotia, and East Africa. So that's not next door, I guess I'll put it that way. Between 1988 and 2018, Ann worked as a professional program evaluator of international programs funded by the Canadian government and UN agencies, specializing in social development and community health initiatives. She holds a credentialed evaluator designation from the Canadian Evaluation Society. Starting in 2005, while still working full-time, she became a caregiver for her elderly parents in Nova Scotia, a process that continued up until her father's death in long-term care in 2014. Building on her concerns and experiences, in 2018, she completed an MA in Family Studies and Gerontology at Mount St. Vincent University and in Halifax, with a focus on understanding roles of families and family councils across Canada and the Nova Scotia long-term care system. She is a founding member of the new provincial advocacy group that is currently taking shape, Nova Scotia for Long-Term Care Reform, and is also in the process of transforming her recent academic research into a newsletter, social media forum, and volunteer resource center to promote awareness and training around the role of family councils in Nova Scotia long-term care facilities. So, Ann, thank you very much for joining us.
Okay, thank you. I'll just get my screen share set up, and then maybe I'll turn off my video first and then get the screen share.
That's really not me, that's Ann.
Okay, great. Okay, thank you very much. And yes, my ID says Ron Swan, but I think it's just because Ron sent me his link for me to log on, and that's why you know, I'm traveling under an alias today. Thank you very, very much for inviting me, and welcome to everyone who's online listening to this. This is a great forum and a very interesting session. The theme today that I'm going to focus on for the next few minutes is that of a citizen activist view of long-term care issues, and not so much an expert perspective. Now, I think we all see a role for experts like Dr. Brake and many others who've done tremendous research and work and advocacy in long-term care. But I think that one thing that the pandemic has taught us is that a much wider range of voices is required as well to bring forward all the concerns and issues that are out there. I'm going to speak for a few minutes mainly to the Nova Scotia context, but I hope that what I say may be applicable to other provinces in the Atlantic region as well. And I have to stress that really my views today are very personal. I'm not really representing any specific organization, even though I will speak in a minute about the Long-Term Care Reform Coalition. And so I'm bringing to this a combination of personal lived experience, as Ron just mentioned, and research that I was able to pursue for my MA in gerontology at Mount St. Vincent in the last few years. And so this is really based on my own interest in, trying to create, be an advocate for change as a citizen activist in the context of long-term care in Nova Scotia and in Canada. So I'll start off by saying, just introducing this new coalition, because I think this is a great example of citizen activism, which is taking shape in Nova Scotia. And of course, all of the work that Carp is doing and that what they've been presenting today is related to the same theme of citizen activism. So, as I say, I'll come back to this throughout my little chat here. I think the idea of forming this coalition was to consolidate the work of several different groups over the period of the last few years that have each been working in their own way on long-term care issues in Nova Scotia. But the idea was in this partnership to really bring forward a lot of the so-called, unheard voices in long-term care that haven't always been heard from in the policy and decision-making discussions. And we will formally launch our coalition relatively soon. I'd say within the next couple of weeks. We're just finalizing our mission statement and, sort of tweaking our governance structure and finalizing our list of, committed partners and members that we can announce formally. But this list on the slide just gives you a sense of who's involved in the coalition. And we're, of course, actively soliciting to get more and more people involved, and we're looking forward to working with Carp on this as well. We want to build on the core principles that I've listed here to create very specific policy-oriented change and changes in practice that flow from, improved policy directions in long-term care in Nova Scotia. And I just have to say, though, and I'll just make a very quick aside, is that I heard somebody said the other day, which said that improvement is the enemy of change. And I think that's something that we do have to keep in mind here, because many of our speakers today have mentioned the fact that we really do need a complete revisioning. So we may use the term improvement or whatever, but I think that most of us are looking for is a much deeper and more fundamental reform in the system. So in Carp presentation a little while ago from the Carp National, one of the people involved in Carp at the national level mentioned this particular study, which was produced this summer, and I've copied the link here. And there are many, many excellent studies and reports that have been produced this year as a consequence of what happened with the pandemic. The pandemic, ironically, has been this amazing catalyst for bringing out all kinds of studies and information about long-term care that haven't been in the public domain or haven't been widely circulated before. So that's very exciting. It's just so horrible that it had to be as a consequence of this tragedy. But I would really encourage everyone to look at this particular briefing note or this particular policy paper, just because it's really easy to read. It's the compilation of what many, many experts have been saying, who've been advocating for systemic change over the past few years. And then they too are starting to say, well, look, we've been saying this for years and it's time that people really pay attention to this. And so I think this is a very accessible and excellent kind of national policy document that everyone who's concerned about reforms in long-term care should definitely take a look at. So let me talk about the provincial context for a few moments, and I'm calling it a crisis. I'm sure some people would disagree with that, but I think based on what we've seen, we are in a crisis. I have to say that I'll just to clarify the terminology, that the terminology continuing care in Nova Scotia includes both home care and long-term residential care, which are meant to both be included in this continuum of care, which I'm sure others are going to talk about today too. So I won't go into that in too much detail. Interestingly enough, there was a 10-year continuing care strategy that was launched by the government of Nova Scotia in 2007, not the current government, but 2 governments before. And that continuing care policy was actually quite innovative, and it did invest quite a lot in long-term care from the period, I'd say about 2007 to 2012, so that by 2011, there were 1,100 new beds in long-term care in Nova Scotia. There were 13 new modern long-term care facilities, and there were 10 modern facility expansions. And this continuing care policy was actually quite exemplary. But starting in around 2012, 2013, maybe not coincidentally, when a new government came into power, I think that the level of interest really started to fall down in this continuing care policy. And then the subsequent government has also continued into this sort of period of stagnation that we've been in. There were also a couple of other reports in 2015 and 2018 that identified a lot of systemic issues in the long-term care system in Nova Scotia, but these were not necessarily, I don't think, and a lot of people don't think, we're taking that seriously. So of course now we've had this irony of having this horrific incident in Northwood where 53 people died in one long-term care facility. And recently on September 21st, a review of this situation was released by the Minister of Health in Nova Scotia. And I think most people would agree that this was a very limited review. Many, many people would have liked to have seen a public inquiry, but we were unable to mobilize as much as we would have liked to get this off the ground. And there were various political reasons why I don't think an inquiry would have been launched by the government. But this inquiry, even though it was very limited, we've looked at it now, and even though it was very specific, it was meant to be very specific to what happened in Northwood, it did touch on several systemic issues in long-term care, which were mentioned in other reports, including an outdated legislative framework, chronic staffing shortages, and really deteriorating infrastructure that, where the investments were not being made. So anyway,
Wrap up pretty soon there, Anne.
Okay, sure. I just have a couple of slides left here. So many, we're hoping that this particular juncture is a way to create a groundswell of interest in increased investment and a clear vision for how to move forward in long-term care. And also, of course, we need a renewed continuing care policy that talks about not just about long-term care, but home care and how that is going to mesh together. So what next? We're hoping that we're very happy to work with Carp. I think that the Nova Scotians for Long-Term Care Reform, we want to create we're going to release a public response to the Northwood Review, and we're going to build up a strategy for ongoing advocacy on staffing, infrastructure, and quality of care in long-term care in Nova Scotia, come up with specific actions around that. We're hoping to create a groundswell of citizen activists, and we just want to mention a couple of things. I mean, my own personal interest is in promoting the role of independent family councils in long-term care as a voice for family advocacy. So I'm hoping that that can get off the ground. And there's also a very interesting group, the Reunite Families for Long-Term Care Residents, that now has 700 supporters that are monitoring the inconsistent application of the family visitation policies in long-term care. And so they are another exciting example of how citizen activism has really started to come into its own in long-term care. So just to conclude then, I won't take up any more time because I'm sure we're going to have a very interesting discussion, and we need to hear, of course, from Anne Camozzi about her own experiences, especially with the weaknesses in home care in Nova Scotia, which are pretty profound. But please send me an email if you want to find out more about the Long-Term Care Reform Coalition. We are launching our social media communications soon, but we don't have that set up, but I can put you on our mailing list. Please follow and join Carp Nova Scotia chapter for updates on national and provincial. And we hope, again, that the Reform Coalition and Carp in Nova Scotia can create a good synergy around all of this. Please stay informed about the work of citizen activists like the Reunite Families group. And please write or talk to your MLA and MP. Please make all of your views and questions known about all aspects of continuing care, because if we don't get our voices out there, we're not going to be able to create the type of change that we really need. So I look forward to answering your questions and taking your comments in a few minutes, and thank you very much.
Thank you very much, Anne. Very informative for sure.
I will try to.
And this is Sean from the head office. I just I wanted to interject just with one of the attendees asked for a link to be pasted into the chat if possible. From earlier, I think it was like midway through your presentation.
Sure. I'm trying to, just give me a second while I turn off the screen share here. Just a second.
That's fine.
Just trying to get out of the screen share so that we can get back here to the proper.
Oh, so just at the top of your screen, I think you should have a stop
share. Gotcha. Okay.
Yeah,
perfect.
Sean, it's Sharon. It was on slide number 3, Anne, I think, but it's the Carp paper as well. So that's what folks were looking for.
I think they meant the Royal Society paper. Is that correct?
Yeah, that's the one. Yeah.
Okay, so I will try to paste the link for that into the chat so that people can have access to it, and maybe Carp can circulate it after the meeting as well, perhaps on their Facebook page.
Thank you.
Okay, thank you.
Okay. Very pleased to introduce Anne Camozzi. Anne lives in Antigonish, Nova Scotia, has had an eclectic career, including a few years as a CBC TV and radio reporter in Toronto and Calgary, a term as Vice President University Advancement at St. Francis Xavier University, and an international consultant working in the areas of adult environment education, facilitation, strategic planning, and board governance. Now working as an artist and author, and I'll direct you to her website later. It's doing some great work in that regards. You can see her art at the QE2 Hospital in Halifax and many other healing spaces. She has presented and written about the need of integration of the arts into many aspects of life, but especially for healing, dementia, and palliative care. Living with a disability as a wheelchair user and long-term home care client, as well as a caregiver to her husband, now in long-term care, and is an active disability and seniors advocate, and has been working for changes in continuing care system for 13 years. She's a proponent of universal design and aging in place based on her lived experience in healthcare and continuing care systems and what she's learned through research and her disability advocacy. She has a Bachelor of Fine Arts honors from York University and a Master's in Adult Education from St. FX, and is a mother of 2 children and a grandmother of 4. And her website is annecamozzi.com. And thank you for joining us today.
Well, thank you very much. I'm really honored to be here. And I see that it's 3:49, and I don't think I'll do all my 7 minutes. I'm going to try and go fast. And what I want to say to everybody who's out there is be ready. Be ready for the safety net that is not there for you as seniors. And I'm going to tell you briefly our story. My husband and I are both have master's degrees. We're both professionals. We both paid taxes since we were age 14. We lost our home, our waterfront home, 3 acres of waterfront land, our vehicles, our furniture, each other, all for the lack of nighttime care for somebody with dementia. So I'll get into a little bit quickly about what that means. But now as a 66-year-old wheelchair user living alone, and I want to make a point from the national thing is that I didn't get the disability credit that everybody else got because that was denied to seniors who are disabled. So disabled seniors have double the cost, and we've been really forgotten in this pandemic. I face actually long-term care now, or considering medically assisted dying to avoid long-term care, as there are no other care alternatives for me, where I don't need long-term care, but I just don't have enough supports. My husband went into care 5 years before he needed to. Add up the numbers, folks. Add up the numbers at what this costs the government instead of home care. Forget the personal pain and suffering. We cost this government hundreds of thousands of dollars compared to the small amount for a client-centered home care approach. One size doesn't fit all in terms of solutions. The issues have been overstudied. I contributed to all those previous reports. The bureaucracy is very layered, manager heavy, and they have meetings rather than frontline staff. So we're all one community. I was trying to do screen sharing, but I'm too disabled. So I'm just going to hold up my art. So this is a piece of my art. I'm really low tech here because I'm a pretty disabled person, but we're all one community. You know, we have to focus. We have to demand to choose cheaper, more client-friendly options for aging and dying in place. There always will be some need for long-term care, but believe me, not at the rates that people are being warehoused, and there always will be a need for hospice as well. But not at our current model and the allocation of dollars, as Bill really well laid out in his national presentation. We have to refocus the conversation to continuing care, not long-term care. Bureaucratically, continuing care covers long-term care and home care, and nobody is talking about home care. So the number of hours that I'm allowed a day, which I don't even get, if I got those, I'd be like freaking happy, but I'm allowed 3.5 home care hours a day. Currently, as a severely disabled person living alone in Nova Scotia, I'm allowed 1 bed change every 14 days. That doesn't matter if I have an accident or something happens. I get my bathroom cleaned every 14 days. I have 1 hour of support in the morning, 20 minutes of support at night, and 2 hours of cooking a week. There's no advance notice of any of those appointments, so I cannot plan. So I also get VON nursing support. If that happened to be right now, I wouldn't be on this Zoom call. So home care can be expanded to encompass hospital in the home, hospice in the home, relieving overburdened, expensive hospital care, currently only linked to the VON. In some places, it should be linked everywhere. It should be client-centered, it should be inclusive and accessible. So I forgot to set my timer, but I'm trying to go fast because I know that we're short on time. The home care and VON right now, there's lack of recruitment and retention of frontline workers. CCAs are more desperately needed in home care than they are in long-term care, but nobody's talking about that. I was abandoned for a whole week during the pandemic and had no care at all and had to lay in my stink till my family got PPE. I was the one who predicted that home care would bring COVID into long-term care because there was no PPE for home care, and it did. And I was the one who fought for PPE for home care workers. So we have been nickel and diming frontline workers. The VON workers and the home care workers can't work to their full level of potential because they're in such a hurry. They have GPS trackers on them. We have overcrowded hospitals with people waiting for long-term care. My husband was in a hospital, a full center regional hospital for 1 year for lack of home care. This doesn't make any sense. And there's waiting lists everywhere. I crushed my foot last year. I had to wait 5 months on a waiting list to get help. And during that time, I fell 3 times and it could have been the end of my life. If I sound passionate, it's because we are failing hugely and we don't have time now to study this. We need you all to call your MPs. We need you all call your MLAs. We need you all to join Carp. We have to become, I've been fighting alone and I'm really happy and honored to be joining the Carp team. Thanks for listening to me and for putting up with my passion.
And thank you so much for sharing that with all of us. You referred to yourselves a couple of times as being disabled. You're not disabled at all. You're a person with a disability, but you're by far the most able person that I've listened to in some time. So
thank you very much.
Very, very proud of that.
Thank you. Thank you very much.
Anyway, that being said, I think we want to start a conversation now. You've heard from some very different perspectives on some of the challenges that we're facing as we all get older, and where do we go next?
Ron, I don't see any questions in the chat box to be brought forward. There are a lot of comments, and and the various links have been posted there for people to have a look at the resources. I think, it's hard to follow something like the presentation that these three very, very powerful speakers have given us this afternoon. And so we're getting a lot of thanks in the chat box for the information, but I think more importantly for their commitment and their passion for the issues that are impacting us. And I think Anne, last Anne, has left us, as they say in Newfoundland Labrador, and I'm sure they say it in Nova Scotia too, gobsmacked. And that means speechless.
Well, if everybody else is speechless, I'll take one of my minutes then, because I think I only spoke for about 4 minutes. I was trying to go fast. The one thing I really want to emphasize about long-term care is my husband is there. I saw him for the first time on Monday in 6 months. It was probably one of the most heartbreaking experiences of my life. They have locked people away, and if there's very inconsistent delivery of the easements of restrictions, and the Reunite Families website that Ann Gillies referred to, I would urge you, if you have a person in long-term care, to go there and report. They are trying to, I'm not part of the group. I'm just fighting to stay alive here, folks. But it's very important that we document. A lot of facilities are not opening up. I cannot get my husband out for a dentist appointment. So we are aware of the fact that it's not being opened up. And if it gets locked down again, we have to look after these people. I lost my husband during the pandemic. He went from a man who could watch a new movie on Netflix to saying to me on Monday, Annie, there's a black box here that used to be important, but I don't know what it is anymore. So that's my last comment.
Thank you. Thank you, Anne. Thank you so very much. Suzanne, just to wrap back around, did you have a comment, follow up on Anne, and then I'll ask Ann Gillies to make a final comment, but just a 30-seconder.
Seriously, Sharon, what can I say? What can I say after listening to Anne and Anne? You know, we know it's happening for years and years and years. We have chosen as a society to institutionalize people. So how can we like make that paradigm shift? And the only way to do it is through the voices of people. We have to demand it.
Exactly. Thank you, Suzanne. Anne?
I don't think I really want to add too much else. I mean, I think we need to defer to any additional things that Ann Camozzi wants to say. I think I've said my bit, but I just want people to speak out too. I think that's extremely important.
Sharon, I'd just like to comment if I could.
Sure, Bill.
Starting tomorrow morning from 9 to 11, the Carp Advocacy Committee is meeting by Zoom. And we're going to continue this conversation and look to bring some structure and some discipline to how we take next steps. And so this conversation is going to continue. I'm really excited about the team that's been brought together to do something, and I'm so proud of the work that we're all doing.
Exactly. Thank you, Ron.
Yeah.
Bill, did you want to have a few final words? There is one question, if I could just interject.
Yeah.
Bill, maybe this is better addressed to you. Well, first of all, how old do you have to be a member of Carp? And I think the answer to that is we're not age restrictive or age, you have to reach a certain age. So if you're looking to be a member, just go to the Carp website and sign up. We're happy to have you. And Bill, you can answer both questions, but and the other question is, what are the unions and Canadian Labour Congress doing to help this advocacy? Do you want to take that?
Sure, I'll take both of those. First of all, no, there is no age to be a member of CARP. We have many young members. The chair of our Toronto chapter at one time was still in her late 20s when she was, but she was very concerned about her parents who had aged more quickly than she would have wished, and she saw what was happening to them and wanted to get involved right away. We have many members of the sandwich generation who have both our children still in school and our older parents that we're still looking after, and we're concerned about our own later years and what's going to happen, because we all know that the age group that we represent in terms of older adults, CARP, is growing all the time. You know, the good news is that people are living longer. The bad news is that means there's more people who have lived longer. So when we're talking now about all the issues that we're dealing with at our ages right now, this is just the beginning of what's going to happen as that boomer blip moves through. So it's even more important. So, you know, when people talk to us about, for instance, our concerns around long-term care, but adding to that, the real need for more care for people still in their homes and in their community, that's because we'll never be able to build enough institutional homes, even if we wanted to, and I don't think we do, to look after all those people. We have to look after people in their own communities just as long as we can. So long answer to anybody can be a member. The answer about the national unions are very active in this. CARP sits nationally on a number of national committees where we're all around the same table together. The one that comes quickly to mind right now is the pharmacare issue. We have a meeting of that coalition next week where many of the unions are represented. In fact, with the umbrella union organizations on, I think we probably have every union in the country involved in the pharmacare issue. So certainly they are involved. We've heard some wonderful presentations, some from the heart things that are happening right here in Atlantic Canada. I'm pleased that we're welcoming. You can't all, but I can see the list of everybody who's watching, and we have a large number from both New Brunswick and from PEI. We have our newly acclaimed leader on PEI, Bob McKenna, is watching right now. All of us have a tremendous amount of work to do in our own provinces. Nationally, we're going to give you as much backup as we can in terms of resources. But you know, when push comes to pull, the only way we're going to make changes is by having the politicians we elect, whether that's municipal, provincial, or federal. The politicians have to demand this happens. And they're only going to ask for something if you and I, who vote for them, say to our own local politicians, we want this to happen. Because when, I was on the radio and TV 18 times this week. Do you think that did much good? No, I think people are interested and we have a message we want them to know about CARP. But when the politicians hear, that's just Van Gorder again. That's what he does. He's been doing that for 20 years. We're tired of hearing from him. But when you talk to your politician and you say, I'm not going to vote for you unless you'll do so-and-so, and then follow up after they're elected, that's the only way that we'll really get results. So that's my message to everybody who's watching right now. We'll give you the information, give you the studies, give you some idea what's possible these days where there is some interest on the other side. But bottom line, you've got to talk to your politician in your local community. Don't send them an email. Bother them with a phone call, a visit if you can, or a letter written in hand by pencil. That's the kind of thing they actually read and notice.
Thank you, Bill. And just to follow up on that, you know, there are other things too that we can do in addition to just speaking to these folk. You can talk to your friends. Tell your friends that you participated in these 2 sessions this afternoon, and what you heard and what you know yourself, and get them, instill in them the passion that we need to bring it forward, because you have to believe in the issue. If you don't believe in the issue, you're just going to hear it and forget about it. But if you believe in the issue and its importance, then you will talk to your family, and you will talk to your friends. And, you know, how many times do we engage in conversations at the checkout in a supermarket, at our church groups, at our knitting clubs, or our sports clubs, wherever we happen to, our card games. So there's always a place. And if you're uncomfortable talking about it, there's people like us and others who are more than happy to talk to any groups that you might know or be associated with as well. So with that, I think we've kind of used up all of our time and probably gone over a little bit more. Bill, well, on behalf of me, on behalf of Suzanne and Anne and Ron and yourself, I'd just like to say thank you, everyone. This has been an extremely productive afternoon. I want to thank you for your interest in the discussion, but more importantly, to implore you not to let the conversation die. We must keep the pressure on governments. We're a powerful group, as Bill has said and others have said. We have power at election time. We built this country. We contribute multiple hours of volunteer time to our families and our communities. And now it is time for us to take action for our loved ones and for ourselves and our future. So thank you again, everyone. And I
did have sorry, Sharon. I did have one question. Is there an email address that they can write to for a copy of the slides?
I would anticipate the Nova Scotia email. Ron, Nova Scotia, you're muted.
Sorry about that. Yeah, you can send it to chair@carpnovascotia.ca, and we'll get you a copy of Ann's slides.
So that was
Okay.
chair at Carp, Nova Scotia?
Chair at, yeah.
At carpns.ca.
I know, all spelled out.
Sorry,
Right.
sorry, my mistake. Carp, Nova Scotia, all spelled out. .ca.
Okay.
And Ron, if you would share that with us, we can post it then too.
Okay,
Any of those, yeah.
I will do that, Sharon. Yeah.
Thank you. Okay, thank you, everybody, from my perspective, and Dr. Brake and Anne and Ron and Bill. Thank you again as also for your time. And this has been a productive afternoon, absolutely. And please keep the conversation going.
Thank you.
Good night,
All the
everyone.
best.
Thank you, everybody.
Yeah.
Thank you, Sean.
Thank you, everyone.